today we're here with Ryan. Ryan came to see us back in January. Is that correct?
Yeah.
I think I think you had the procedure done about the 18th.
Mm-hmm.
Came to us initially looking for a different option
Yep.
than a surgical intervention
Yep.
for his right shoulder.
Yep.
If I recall, you were about 3 days away from making a decision or having the shoulder surgery
I
itself.
was scheduled that week. Yeah, I came in on a Monday, I think, for my first appointment to consult, and my surgery was actually scheduled for that Friday of that week.
Right.
So yeah, it
Right.
was,
What were you feeling prior to, finding stem cell therapy?
Yeah.
Or your symptoms?
Well, I'd gone probably 4 to 6 months with just pain. Started real simple, progressively was getting worse and worse until it started affecting daily activity. And for me, it was really range of motion type stuff. The simplest one was reaching behind me to dry my back in the shower, and it overextending that shoulder in certain directions while I was getting a lot of pain. So went through the typical steps, saw an orthopedic, got an MRI, and got the MRI read, and he was like, hey, this is classic torn labrum was what the condition was. And he said, so let's get you scheduled for surgery. You're beyond physical therapy at this point, so let's go for a surgical option. So that was where I was going. I was going in to get the torn labrum repaired surgically from my orthopedic, and it was going to be a 90 to 120 day recovery, 1 month in the sling. That's what that's what I was going towards. So
Right.
a month with no mobility, and then physical therapy from there, from 2 to 3 months until I was healed up and good to go. So
Right.
got word of your facility and the stem cell option, literally, like I said, the week of. And
That's
so
great.
called over, made an appointment real quick. You guys were great, got me right in, and just started doing some research, having some conversations, and here we are 8 weeks after now.
And you didn't listen to your orthopedic surgeon?
I didn't even call him back. The only call I made was to
That's
cancel
it.
it. Yeah,
Sure.
the day before to
Right.
cancel the surgery. Yeah,
Well, I'm glad that we were able to catch it early enough
Oh, yeah.
to help you.
absolutely.
So now, you're roughly we're in March now.
Mhm.
Today is the 10th.
Yep.
So you had it done on the 18th of January.
Yep.
How do you feel now
Feel
compared to
great.
was great?
I feel great.
Range of motion,
Range
your
of
pain
motion
level?
is fantastic. I mean, just being able with no limit to go back, to go across, to go up. There's been a couple days where I've maybe felt like I overexerted a little
Sure.
bit. I've been really careful as far as going back to the gym, like you guys told me, as far as
Right.
not doing too much too quick, but just daily activity, washing the car, doing some projects and things around the house, and maybe a couple days I overexerted, but that night, just get some ice on it, let it rest, and by the next day, I was feeling good. There was no pain, so I haven't taken any. I think I've had a headache twice in the 7-week period.
Right.
Take a little bit of Excedrin migraine, knock it out, but no anti-inflammatories
Fantastic.
for the shoulder. So there's no medication involved, anything.
So you never went back to the anti-inflammatories at all?
Never. I haven't used it since.
That's
I mean,
fantastic.
not one time since
That's
I got
great.
the injection. I've used any anti-inflammatories.
Very, very nice.
So yeah, just cruising along, following the post-procedure plan you guys gave me. Probably a little to the extreme. I didn't want to risk anything. I haven't lifted a weight in 7 weeks. I just
Right.
didn't want to risk it. So
Right.
a little bit of light cardio and stuff just to keep my blood
Fantastic.
pumping and get a little sweat going. But
Sure.
nothing outside
Sure.
of that. So feeling really good.
No, I'm very glad to hear that.
Yeah.
But well, thank you for coming out and sharing.
Absolutely.
I know when we do these video testimonials, at some point in time, like we talked about in the hallway,
Yeah,
there'll be somebody that will need to hear you
sure.
and share this with them. So we are very thankful
Absolutely.
for you giving your time to
Yeah.
come back and share your experience.
You bet.
You got it.
And no scars.
That's right.
There you go.
No surgery.
No surgery, no
No
scars.
narcotics.
That's right,
No
that's good.
post therapy, physical therapy, or no post surgical hardware or
No
any of that
sling.
good stuff.
Yeah.
Fantastic.
Gosh, that's great.
That's great.
Yeah,
Really
we're
good.
happy for you.
Thanks so much.
Okay, thank you.
Thanks,
You
guys.
got it.